Hi, welcome to NurseEdScholar. I have something to tell you. One of the hardest moments for nursing students is this one. You see a medication order, you see abnormal labs, and you think, am I supposed to give this or hold it? So, in today's lesson, it's about medication and lab red flags and how the NCLEX expects you to make the next best decision under pressure. This is not about memorizing lab values. This is about recognizing danger and protecting your patients. So you know, when you're looking at the NCLEX, it's asking you, well, when the questions are asking you about holding medications, it's not about testing obedience. It's about testing nursing judgment. Holding a medication means you recognize a safety risk. You're preventing harm, and you knew when to pause and escalate. The NCLEX rewards nurses, and I'm going to say it again, who protects patients, even when there's an order. Because even though you give an order, you can hold the medicine, especially if it's going to cause harm to your patient. So, with that, before you give any medicine, the NCLEX expects you to mentally check three things. What's the medicine supposed to do? What lab or vital sign is telling you it could be unsafe to give it right now? And then what's the next safest, action? And if the lab value contradicts the medicine's effect, that's a red flag. So, when we're talking about high yield medication and lab red flags, you know, you need to look at, are the lab values contradicting the medication action? We talked about trends in one of the other videos because trends matter more than single values. Safety overrides routine administration. Like I said before, just because there's an order for it doesn't mean you have to give it, knowing that it may cause an adverse effect on your patient. Okay, so I'm going to talk about several high yield medications and their lab red flags. First to start off with is insulin. Okay, insulin, the purpose of it is to lower blood glucose, but a red flag would be, the lab glucose, reading is low, showing hypoglycemia. Because the NCLEX wants you to think, okay, giving insulin will worsen the problem. And so, what you're going to do, you're going to hold the medicine, so hold the insulin, you're going to treat the hypoglycemia, and you're going to notify the provider. The next, potassium supplements, and then there's a high potassium. Okay, what is potassium supplements? What are they supposed to do? Well, they are supposed to raise the potassium levels, right? But the problem is the lab value is showing hyperkalemia. And if you give that potassium supplement with the hyperkalemia, it's going to cause life threatening arrhythmias. So, what's your action going to be? You're going to hold the potassium, you're going to place the patient on a cardiac monitor, you're going to notify the provider immediately. Digoxin, and the patient has a low potassium, or you notice that the patient has an elevated digoxin level. Now, digoxin is supposed to improve cardiac contractility, but when the potassium's low, or there is an elevated digoxin level, that can lead to digoxin toxicity. So, what are you going to do? You're going to hold the dig. You're going to assess the patient's apical pulse, and you're going to notify the provider. ACE inhibitors or your ARBs, and then there's a high potassium. Now, ACE inhibitors and ARBs, they're supposed to lower the blood pressure and protect the kidneys. Okay, but you look at the lab values and the patient has hyperkalemia. Remember, ACE inhibitors can increase potassium levels. So, what are you going to do? You're going to hold the medication, you're going to monitor the potassium level, and you're going to notify the provider. So that's why when we tell you, you really have to, know it all, because the medications can really cause adverse effects on your patients, especially, if they have, an abnormal lab value. So with metformin, you have metformin ordered, but renal impairment, or the patient is going to a contrast study. Okay, so what does metformin do? It's supposed to lower glucose, but the red flag is the patient has noted impaired kidney function, or they have an upcoming contrast study. So that could be a CAT scan with contrast. Okay. And what happens is that when you give the metformin and their kidney function is impaired, or the patient takes that contrast dye, it can cause lactic acidosis in your patient. So what are you going to do? You're going to hold the metformin and you're going to notify the provider, because you're going to restart the metformin only when the renal function is stable. Okay. And that's why when you're working, especially like in the ER, even on the floor, they're going to ask, is the patient on metformin? And so they're going to try to, give orders to try to protect the kidneys as much as they can. But if you're in the ER and it's an emergency, they're going to do the best they can, because the emergency typically may outweigh the risk of the metformin in the contrast dye. So anticoagulants, all righty, but the patient has active bleeding or high INR. So what's the purpose of anticoagulants? Is to prevent clotting. So the red flag is going to be your patient is actively bleeding, or there's an elevated INR when a person is on warfarin. So what are you going to do? You're going to hold it. You're going to hold the anticoagulant. You're going to assess the bleeding, and you're going to prepare for reversal if needed. Understand, for all medication holds and the lab, red flags, remember, before you call the provider, you're going to perform the intervention, you're going to reassess, you're going to get vital signs. Okay. And the intervention is 9 times out of 10 hold the medication. So, the NCLEX wants you to recognize that vital signs trump orders. If your vital signs are off, you don't give the medication. So, for example, if you have a low blood pressure, you're going to hold antihypertensives. If you have a low heart rate, you're going to hold beta blockers. If you have a low respiratory rate, you're going to hold opioids and sedatives. If you have a low oxygen saturation, you're going to prioritize oxygen, not the medicines. So if they have a low O2 and you're about to give your medicines, you're going to sit the medicines down and you're going to put 2 liters of O2 on your patient and assess your patient. You're going to stabilize that oxygen level. Okay. Because if the vital signs make the medication unsafe, you pause, you hold it. You don't continue with giving the medicines. Now, under pressure, the NCLEX is asking, what would a safe nurse do right now? Often the correct answer is hold the medication, assess your patient further, notify the provider, and prepare for an intervention. I want you to remember that holding a medication is not a passive act. It is an active safety decision. Okay. So let's look at some scenarios. Scenario 1, a patient's blood glucose is 52 milligrams per deciliter and insulin is scheduled. What are you going to do? The most concerning thing is hypoglycemia. Well, the patient's blood sugar is already low. So what are you going to do? You're going to hold the insulin and you're going to give glucose. Okay. Number 2, the potassium level is 5.8 and they have an order for potassium chloride. So what's your main concern? With the potassium level 5.8 and you have a potassium supplement, it's going to make that hyperkalemia worse. So what are you going to do? You're going to hold the potassium and notify the provider. And the last one, the digoxin. So you have the patients on digoxin, their potassium is 3.0 and there's nausea. So now you have a low potassium level. And the concern is digoxin toxicity. So what are you going to do? You're going to hold that digoxin and you're going to notify the provider. It's very important to know your lab values. Yes, we know that the NCLEX now and in schools, we are giving you the ranges of your labs. But just because you know the range, do you know what to do if it's out of range? And that's what you're going to be tested on. Can you recognize that? So, why students miss these kinds of questions? Well, a lot of the times they trust the order instead of the patient. Students say the doctor ordered it and that's it. They may focus on memorization instead of safety. They don't connect the labs with the effects of the medications. And they may just freeze. They may just I don't know what to do. Okay. So competent nurses, they're going to make sure that the labs are safe before they give the medications. They're going to recognize the red flags early so they can intervene. and they're going to act decisively. It's all about patient safety. And what do we have to do to keep our patients safe? So that's really it. Medication safety is not about memorizing drug lists, and I've said that before. It's about recognizing those red flags, protecting your patients and choosing the next best step. And sometimes that is holding a medication. So please download the Pharmacology Safety Mini Workbook at NurseEdScholar.com to practice medication in lab scenarios. And please subscribe, like, and subscribe for more NCLEX focused lessons to help you really, think like a safe nurse. And thank you for tuning in to Nurse Ed Scholar. We're trying to help you study smarter and test like a pro. Thank you.